Two new seemingly contradictory studies on cancer rates in the news today. One predicts cancer will overtake heart disease as the world's #1 killer by next year. The other finds cancer rates down in the U.S. for the first time. Here to iron it all out is Dr. John Seffrin, the CEO of the American Cancer Society. He joins us now via satellite from Atlanta. Dr. Seffrin, welcome.
Thank you. It's good to be here.
First of all, let's talk about the good news. Tell us about the new statistics regarding cancer incidence and death rates in the U.S.
Well, for the first time in my lifetime, we were able to announce proudly just a few weeks ago that the cancer incidence and cancer death rates are both going down in both men and women here in America for the first time. So it's really good news. Death rates started going down 15 years ago, and they've gone down every year, year over year for 15 years. And there are now about 620,000 people alive who wouldn't be with us today if the cancer death rates in America had stayed the same as they were in 1991. So that's really good news. It's not only meaning we're saving more lives every year than ever before, but it also is a proof of concept that we can save even more lives worldwide if we can do some of the things around the world that we're doing here in the United States.
Well, let's talk about what is accounting for the progress we're seeing here in the United States.
Well, we know and have been able to prove that the progress we've made here is an admixture. It's a combination of both prevention and improved therapy, and that's really, really good news. For many years, even decades, people thought the only way we're going to save anybody from cancer is to prevent it, and that's the best way to do it. But we now do have effective therapy, so more and more people who get cancer that wasn't prevented can be successfully treated and cured. So basically, the biggest piece of that is prevention. We now know how to prevent 60% of all cancer during a normal human lifespan. And when you think about the fact that there's 1.4 million new cancer cases in America every year, 60% is a very big number.
Now we just got to work on that other 40%. Let's talk a little bit about the bad news now. Cancer rates worldwide doubled between 1975 and 2000, and they're expected to double yet again by 2020. Do we know why?
Yes, we do know why, and I think it's very important for our listeners to understand that the cancer death rates doubled over the last quarter century, and they're going to double again in the next 20 years if we don't intervene. But if we intervene, we can keep that from happening. So what's happening? First of all, the most important thing is that we now have something like 1.2 billion people in the world who smoke cigarettes every day, and that's the #1 cause of cancer. In addition to that, it's an aging population globally, and a lot of people don't realize it, but we're not just getting older here in America. The population all around the world is getting older, and as age increases, the risk of getting cancer increases. So we understand much about cancer today, particularly how it develops within the cell and how it develops as a major epidemic in the population. But we have to intervene to keep it from getting worse, and those kinds of things are many and varied, but all the common denominator is that we have to change behavior and we have to change public policy.
Okay, and that is a tall order when you talk about all the people involved by that. Thank you so much, Dr. Seffrin, for joining us today and answering some of these questions about these intriguing studies. You have a great day.
Thank you very much.
When you think health, think IRU.